Good afternoon. If you're joining us for lunchtime, we're glad to have you here live. And if you're catching up later, we're glad to have you anyway. But we're here today to present the DeLand Chamber and Orange City Alliance 2020 Health and Wellness Symposium. There has been no year like 2020 for most of us, and there is no better topic than health and wellness. We are very fortunate today to be joined by three representatives of three of our DeLand Chamber and Orange City Alliance organizations. They are here to tell us more about what's going on with our organizations in 2020. Well, of course, we'll talk a little bit about COVID, but we'll talk about health and wellness in general and the things that these great organizations have to offer, not only our community as a whole, but other businesses in our community. Joining us today from DaVita Labs, we'll have Carrie Wagner, Vice President of our DeLand location. Joining us from AdventHealth, we will have Michelle LeBron, the Chief Nursing Officer. And joining us from Florida Healthcare Plans, we will have Dr. Felucio Ogunfididimi. And we're glad to have all of them with us. And we're going to welcome them all to join us right now on the call. Thank you to all of our panelists. Thank you to all of our sponsors for making this possible today. Let's jump right in. Welcome to all of our panelists. We're going to jump right in with Dr. Ogunfididimi. He is the Administrator for Practice Management at Florida Healthcare Plans. And I wanted to start with the most challenging name first. And so thank you. And it's Dr. O from now on. Tell us a little bit what's going on. Tell us about Florida Healthcare Plans and tell us what's going on with your organization here in 2020.
Well, first of all, thank you for having me and having us in this panel discussion. We really appreciate the invite. And as you mentioned, we really cherish the relationship that we have with DeLand and DeLand Chamber. And hopefully we can kind of share some opportunities. And then I do want to thank you for taking a stab at the name. That's a little courageous. So that's the way to get started. So anyway, my name is Felucio Ogunfididimi, as you mentioned. I'm the Administrator of Practice Management at Florida Healthcare Plans. Florida Healthcare Plans really is one of the oldest and longest running federally health maintenance organizations in the state of Florida. And actually, nationally, we've been around since 1974. And we kind of have a mixed model. If some of you are familiar with the Kaiser model out in California, we kind of have that same mantra where we provide our members with healthcare insurance, but we also have a significant amount of healthcare services that we deliver directly to our members. So we provide the insurance and we also provide the clinical services, giving us the opportunity to really maximize on delivering health and wellness and preventative care to our members, as you've kind of alluded to. We cover we're primarily focused in Central Florida. We cover 5 different counties in Central Florida: Volusia County, Flagler, St. John, Brevard, as well as Seminole County. And in each one of those counties, we have clinical practices, which are primarily primary care practices, as well as specialty clinics or multi-specialty clinics. We also have pharmacies in all of those 5 counties, a total of 17 pharmacies, retail pharmacies that provide services. So we have a collection of primary care services, multi-specialty services, and pharmacy services, some pharmacy retail services that we provide to all of our members. We also have an ambulatory surgical center in Volusia County in Orange City. So we also have, to a certain degree, the ability to be able to provide our members with same-day surgical practices. The advantage that we've had, and I know we'll talk a little bit about this down the line, the advantage of being in those 5 counties and having a total of 22 practices spread across those counties is that it allows us to reach out to all of our members on a wide spectrum. And as we talk a little bit about what we've done with COVID, it has really helped us because we have testing sites now in each and every one of those counties. So any member that is a Florida healthcare member, including in DeLand, you don't have to go too far from your home to be evaluated, to be seen, and subsequently in this COVID era to be tested for COVID.
Outstanding.
Yeah.
Tell us about some of your current programs and community relations. Specifically, I know a lot of people have avoided going in for what we would consider our more normal routine checkups, maybe a cold, maybe a flu, they're not sure what they have. Is it safe for people to come in and have their regularly scheduled general visits and some of what we might consider the minor visits that they would normally have with their general practitioners?
Okay. Yes, very good question. So we cover about 90,000 lives, and at the at the onset of COVID, just like most of our other organizations and sister organizations on this call, we had to kind of change our model overnight in terms of being able to prepare our members to be able to come in. So fortunately for us, we did have some form of a telehealth platform that was utilized on a small scale, but at least we had the foundations in place. We quickly put that, geared that up into full gear, and that was our initial outreach to our members. During that time frame, we used it to really redesign our practices to now accommodate in-person visits as well too. So in the long story short, we now have the ability to do both in-person visits, which is actually a little bit more than our telehealth visits now as we speak today. But we've also expanded our telehealth services dramatically, literally overnight. So any of our members and the community coming into our practices has the ability to be evaluated either via telehealth or via in-person with a significant amount of safety measures that we've put in place. Some of those measures include, obviously, taking temperature checks on all of our members coming in. We do have a mandate to have all of our members come in with a mask, at least wearing some form of a face cloth mask. All of our employees are wearing surgical masks or an N95 mask, which all of you are probably now familiar with. And we have daily environmental and cleaning procedures in place to be able to make sure that our practices are as sanitized as possible. And in certain places, we've also been able to create social distancing measures via physical barriers. We've remodeled the waiting rooms in our practices. We've kind of turned chairs around to prevent people and create that 6-foot distance as much as we can. So, and I'm sure all my colleagues on this call will probably tell you something similar along those lines. We've really had to change our entire practice model overnight to kind of accomplish that.
Thanks so much for sharing that with us. If someone wants to learn more about Florida healthcare plans, is there a website they can visit?
Yes, we do have a website, fhcp.com, www.fhcp.com, that anyone can log into and get a sense of all of our practices. As I mentioned at the beginning, we are an insurance company, so we do offer healthcare insurance. We offer Medicare Advantage as one of our programs as well too. So we have a wide spectrum of plans available for the community to sign up for, and this is actually during open enrollment right now. The beauty about our plan is that you come into our plan and then we offer you those clinical services right then and there. And because we don't have a traditional, and I won't belabor you with some of the technological stuff, but we don't have a traditional fee-for-service module, it allows us to really do a lot of preventative work that I'm hoping we can kind of continue to share with you guys today as well too.
Outstanding. Let's shift over for a moment. We're happy to have Michelle LeBron, the Chief Nursing Officer with AdventHealth. Welcome. And tell us what's going on with our friends at AdventHealth in our DeLand and Orange City Alliance greater area that we serve here in Volusia County.
So Thank you for having me. I'm really happy to be here and, share this partnership with you. AdventHealth is a huge organization with over 46 hospitals, urgent cares, physician practices throughout the nation and over 10 states in the nation. But of course, here in Central Florida division, we have over 14 facilities here. And we have unveiled and made so many changes and innovative services that continue to safeguard our patients, visitors, team members, and the greater community. No one should go without medical care out of fear that they are going to contract COVID-19 in an emergency department, hospital, physician practice, or urgent care. And just like Dr. O was saying, we've made many changes to our current practices as well, which includes every team member and visitor wearing a surgical loop mask when in an AdventHealth facility. Temperature screenings have been made once they enter the building, hand washing, of course, and social distancing. We have a robust cleaning and sterilization process that we've enhanced, and we've added more sanitation stations across the hospital. Dr. Olson mentioned our video visits. We are, expanded our telehealth services as during the pandemic to lessen the burden on facilities and providers, but to also provide that additional comfort and convenience for patients that they were requesting at the time, also while not avoiding to come into the hospital when they needed to. We continue to separate our patients in the hospitals. Those that are suspected of having COVID or that have COVID, we do have a separate floor and wing for those patients, just to minimize their exposure to other patients, visitors, and team members. We've made significant investments in infrastructure, personnel, and technology. We've had to add screeners to our facilities to ensure that we can keep up with everyone that walks in through our doors to safely screen everybody and best serve our community. We're very proud that we've been a trusted community partner for over 110 years. Also, I would like to say that if anyone has any questions about the COVID or virus, that we do have a hotline, and it is 877-VIRUS-HQ, and that's available to anyone that just wants more information or needs to know where to go for care.
Thank you very much, and we'll circle back here in just a moment. And is there a website that people can go to learn more about AdventHealth as well?
Actually, AdventHealth.com has many areas where you can get on the website and actually, look in particular, but also AdventHealth CFL safebusiness.com is available. Again, CFL like Central Florida. So it's AdventHealth CFL safebusiness.com.
Thank you, Michelle. We also have with us today Carrie Wagner. Carrie Wagner is Vice President of DaVita Labs here locally. And I don't think a lot of people realize the massive scale of DaVita and your presence here in the DeLand community. Tell us what's going on out at DaVita Labs, Carrie.
Thanks, Rob. I'm happy to be here today. Thanks for the invitation. So many people don't know, as you mentioned, that DeLand is home to one of the largest automated laboratories in the world. We're tucked back in the industrial park by the DeLand Airport, and we perform over 60 million tests per year. And on average, we receive about 100,000 or so specimens per day. So really high volume, fast paced, automated environment. And we exist primarily to serve about 200,000 DaVita kidney care who need labs very frequently, at least monthly and often weekly, as part of their dialysis regimen. And we have over 500 teammates based here in DeLand, though many of them are currently working remotely, our business office teammates, to support that patient population. Something that's been unique about the last few months is that we've had the opportunity to bring up COVID testing for completely obvious reasons. We've added PCR and antibody testing capabilities starting in April. And we initially did that for DaVita's dialysis patients and the teammates who take care of them. Because of the nature of our business, we really don't usually get to have the opportunity to provide. But we started to recognize that timely and reliable testing was a need right here in our local area. And recently we've invested in additional technology, equipment, and very expand that capacity. Now we're in a position to start offering testing to other organizations, and we're currently focused on direct bill clients, so more of the business to business relationship. We recognize that a lot of others in the community are providing good support direct to consumers, and we're in a much better position to support other businesses or healthcare organizations. And you know, we certainly empathize with all the other labs that are really struggling to provide timely results. The testing methodology that we use here takes 6.5 hours just to process a sample, where most lab tests that we run take minutes or even seconds. And we also understand how important it is to each patient, their families, their employers, and the entire healthcare system to get those results as quickly as possible. So we pride ourselves in turning around results in less than 24 hours from when we receive that specimen, and very often less than that. So we've also developed, this is kind of interesting, you're probably largely familiar with the nasal testing methodology, which no one enjoys having done. So we've spent the last few months working with some other labs to develop a saliva-based PCR methodology. So you can collect your own saliva in a little sample cup, add a preservative, and then send that to us. Right now, we're not offering testing to the general public, as I mentioned, but we are working on developing a kit that we plan on seeking emergency use authorization for with the FDA for home collection, where you could collect your own specimen at home and send it to us. And we're looking forward to launching that over the coming weeks.
Well, we've all certainly got used to doing things at home a lot more often than we normally have, so I'm sure that there's a space in the marketplace for that type of service. For those businesses that are thinking they may be the type that might benefit from kind of a direct business-to-business testing relationship, is there a place or a person at DaVita that they should contact?
Yeah, the best way to get in touch with us if you have any interest in learning more is to reach out to us at DaVita.com, DAVITA.
Thanks, Carrie. All of you have alluded a little bit, you know, to COVID and what you're doing. Of course, we've all become very accustomed to wearing masks, especially in healthcare-related facilities, and most of us at our businesses and the places that we shop. What are each of you doing as of now? A lot of things have changed. We thought we knew certain things in March, things changed in April, things change in May. But here we are in November 2020. What are the kinds of things you're doing at your actual business locations? And if you want to comment to individually, you know, you're all in the healthcare field, the kind of best steps that we all can continue taking. There's optimism on the horizon. Pfizer announced this week they may have a fairly efficient vaccine, but no one's sure how long it may last. And of course, there's a large section of our population that may not be interested in taking a vaccine for a while until they see what happens. So I think we're going to be engaged in a different type of general practice for some point in time. Tell us, and Carrie, we'll start with you. What are you all doing at the workplace? And what are you doing kind of personally as of November 2020 to help not only protect yourself, but those around you?
Yeah, and I think you're right that, you know, like so many others, I'm trying to think of this as our new normal. This isn't going to be something that's gone in a matter of weeks or even a matter of months. So we've got to figure out a way to be safe with or without a vaccine for the long term here. So we've taken several measures here at DaVita Labs to try to keep our teammates safe. The reason being that we are the only lab that DaVita has. So it's incredibly important that we remain operational to be able to take care of some of the sickest patients that our healthcare system has. So since March, we've implemented entry screenings, as so many others have. We have a temperature sensor that when you walk through the door, you stand in a certain zone, and the person doing the entry screening can get your temperature reading without getting physically close to you. So that's been nice to have. We verbally attest to our symptoms or lack thereof, and we have advanced screening with a nurse if that is needed based on symptoms or exposure. We've also taken the step that many others have of limiting who we allow on site. So we only allow our essential teammates whose on-site presence is necessary for day-to-day operations, and everyone else is working remotely until further notice. We're just prepared for the next at least several months here to continue that. And I think, as Michelle mentioned, we've added additional sanitization procedures similar to what AdventHealth has done. We bring in a third-party vendor 3 times a week to do some additional disinfection above and beyond what we have typically done in the past. And we've supplemented our janitorial staff to just go around throughout the building, throughout the day, wipe down door handles, microwaves, anything that people might touch more frequently to try to add to that sanitization. We're in the fortunate position, because we're a lab, that we offer testing to our teammates who show up with symptoms or who call us and report that they have symptoms. And the most important thing with that is that we maintain that teammate's privacy. So we de-identify samples and take all the appropriate measures to do that. And our HR department communicates with our teammates who are showing symptoms and does some contact tracing to determine whether others may have been exposed to a teammate who tests positive. And we believe that these measures have worked. We've had a very low incidence of COVID here in our teammate population. So we're very grateful for that, of all of our teammates taking safety measures seriously inside work and outside. And of course, can't say enough about masks. That has been a DaVita policy and required long before any city mandates were in place, and it's something to certainly adjust to, but it's working really well for us.
Thanks, Carrie. Michelle, at AdventHealth, of our panelists today, you obviously are with an organization that has a lot of inpatient facilities. I know one thing I hear in the community and with our members is different stories, and times change and locations change. I think one thing people want to know too is, if someone goes in for a 1 or 2 day stay for a quote unquote routine procedure, are they going to be allowed to have family members with them at this time, or visitors? Or is this a time where you still are a little bit having to be more restrictive at your facilities?
So thank you. That's a great question. We allow our patients, in the beginning, when we were still so unsure of what, how COVID was transmitted and what, was going on. And like you said earlier, wear a mask, wear a respirator. There were so many things that were being, told to us, and how we kept track of it. But now that, we were very lucky throughout this whole pandemic not to have to furlough any of our team members. We were able to make a commitment to our team members that we would do everything that we could to keep them whole, and that is what, mind, body, and spirit. So as a result, we were able to avoid layoffs by, instituting a redeployment system to make our keep our clinical roles filled throughout the time. But also now that everybody has come back to well, not everyone, because we still have some work from home roles, but mostly all the clinical individuals are back in the facility. We are allowing patients and to have visitors. Nothing like seeing a loved one when you're not feeling well that, will make you feel so much better. So every patient is allowed to have a visitor per day right now. Our visiting hours are 10 a.m. to 8 p.m. And visitors are screened just like everyone else that enters our building. They get temperature checks. We ask them to please wash their hands and to have a mask worn at all times. Pediatric patients can have 2 visitors at a time, as well as OB patients. They can have 2 visitors. Of course, we do make exceptions for end-of-life patients, regardless of COVID-19 status, and they can have up to 6 patients per day, and we rotate them out as long as we're not disrupting the patient, and as long as they're comfortable with visitors. We do recommend, our team members that if they are, symptomatic, if they're having any kind of symptoms, to, of course, we have them call employee health, and we ask them not to go to the emergency room if you have no symptoms, or even if you think you've been exposed to COVID-19. We do tell them to self-isolate and stay at home for 5 days, wait to be tested. And then on day 5, that's when you're going to have the best chance of getting a positive test. So testing is available at all centric care locations with appointments, or you can call our 877 Virus HQ hotline to find a testing location. We're also really excited to announce that we're not in the final stages, but AdventHealth has been selected as a testing site for a COVID-19 vaccine candidate. And we have been granted this opportunity through Janssen, a division of Johnson & Johnson. And we're really excited to get. Our goal was to enroll about 4,500 participants in Central Florida over an 8-week period. This is a phase 3 clinical trial, the final phase of a trial before a decision is made on whether the drug gets approved or not. So the vaccine trial is called Ensemble. And if there's any questions on that or more information is needed, it's at AdventHealthVaccineTrials.com. And anyone can call that number to get more information. Look up that website. I apologize for more information.
Excellent. And tell us again that website. AdventHealthVaccineTrials.com, all together. You mentioned something that I got to unfortunately experience in the last few weeks with a daughter that was exposed at school. And I think there's sometimes confusion with folks, but you mentioned 5 days from the date of exposure is the best time. And it is my understanding that sometimes if people seek a test too soon, they will actually be told, hey, if you don't have symptoms and it hasn't been 5 days, just keep isolating. You don't need to have a test just yet. Is that what I'm understanding correctly?
Correct. That is correct. Absolutely. So if you're not experiencing any symptoms, we usually want you to isolate first and then wait the 5 days. As we all know, there is a brewing period, so to speak, of when that virus can become more active, and we want you to have we don't want you to go get tested today and then come back and get tested 5 days later and then have a negative today, but become positive later.
Absolutely.
Thank you. Dr. O, you told us a little bit about what your organization is able to do as far as remodeling some waiting rooms and telehealth. Tell us from a more personal perspective, you as a healthcare professional, what kind of things are you doing in November 2020 for yourself and your family member, whether it be choosing where you go and when, wearing masks, hand washing? Tell us about the personal steps you're taking on a day-to-day basis.
So the first thing that I'll tell you that I've done personally, and I strongly encourage everybody to do, is get a flu shot. Get a flu shot. So I've gotten my flu shot, and not to say, that, it's going to give us any particular protection around COVID, but it's certainly, there's a plethora of data out there about the flu shot and how it does protect you from the flu in of itself. So, and that's a vaccine that we know we have and that works. So I've gotten my flu shot. I've certainly implemented a lot of social distancing. Ironically, my wife works for AdventHealth in the ICU. So when she comes home, you know, she takes off all her clothes. She goes in, takes a shower. I take a shower. So we've kind of created those kind of what we now consider to be norms. We are trying to limit as much as possible going out to dinner or to restaurants or congregating with people that you may not necessarily be familiar with. And while that's extremely difficult, especially as we're coming into the holiday season, I think it's extremely important that we take that caution to bear and are prepared to, at least in certain circumstances, unfortunately, we may have to forego some established traditions around that, especially if you're having gatherings with people that you're not always around or people that you're not familiar with. So we've kind of adopted some of those as well too. Other things that I've done personally that I would also strongly encourage is just, as we've talked about, maintaining preventative health. Carrie mentioned about hand washing, making sure that we advocate for that, obviously using masks, but other things that we've kind of taken for granted, and it's one of the things that Florida Healthcare is really trying to push, is exercising and having good nutritional health as well too. All of those do tend to help in terms of your body's ability to be able to fight off all sorts of infections, of which clearly COVID is one that we have to worry about. And then finally, something that is personal to me because of the services that we offer is trying to look for any avenues of stress relief, of trying to detach or unplug, if you can think of it, for at least a few hours during the day or maybe in the evening. Find ways to unwind. If need be, seek some form of behavioral health opportunities to talk to behavioral health specialists around what your day-to-day activities are and how you can kind of improve your overall mental health from that standpoint in a wide variety of things. These are just completely challenging, new, and unpredictable times. And having all of the tools available to you to be able to de-stress, exercise, eat well, all of those do tend to play a traditional role in terms of making us healthier, and we tend to forget the mental health aspect of things. So we're certainly trying to push that as well too.
Absolutely, and as the husband of a clinical dietitian, she'll be very glad to hear you say nutritional wellness is so important in the big picture of things.
Absolutely, absolutely.
Really want to thank all three of your organizations, Florida Healthcare Plans, DaVita, AdventHealth. You're all extremely valued members of the DeLand Chamber and Orange City Alliance. To all of our members and all of our visitors who are watching this today, we encourage you to visit our DeLand Chamber and Orange City Alliance social media pages and our website to learn more about programs like this, to learn more about our member organizations. Please check out the websites of the panelists that were here today to learn more about their organizations and how you, your families, and your businesses may benefit from being with them. And really, on behalf of myself and all of our members, a big thank you, not just for being a part of the chamber, but for being a part of the healthcare community that, like we all know, has just been stood on its head this year. All of your abilities to adapt for your customers, for your clients, for your patients, we owe you a huge debt of gratitude. So thank you all so much for everything that you all do, and for joining us here today. It's been great. It's been very informative. I really enjoyed talking to all three of you.
Thank you.
Thank
you for having us. Appreciate it.
Thank you all out there in Cyberland for joining us. This has been the 2020 DeLand Chamber and Orange City Alliance Health and Wellness Symposium. Again, check us out on our social media pages, our web pages, to learn more about the next few events. And of course, don't forget to check in with all of our sponsors. We couldn't do these things without them. We look forward to a healthier and happier 2021 where we can do more things in person. In the meantime, everybody be well, wash your hands, keep your masks on, and take care of yourself. Thank you all very much for joining us.